How to ensure that your reproductive system is always in prime condition. Knowing how to properly care for your reproductive system is essential for living a happy and long life, regardless of whether or not you plan to have children or focus on improving your overall health. Unfortunately, in the United States, 1 in every 8 couples will experience difficulties in conceiving a child when they are making pregnancy plans. Both women and men need to make their reproductive health and wellness a top priority in order to avoid any potential issues. But how exactly should one maintain healthy care for their reproductive organs? What steps do you need to take to guarantee that you won't have any problems with your reproductive health? You have, by some stroke of good luck, found the appropriate article. In this video, you will find out everything there is to know about the reproductive system, as well as how to properly care for it so that you can maintain your health. Before you do anything further, it is imperative that you consult a qualified medical professional in order to obtain specialized guidance. Also, before we start, hit that subscribe button. The uterus, the ovaries, the vagina, and the fallopian tubes are all examples of reproductive organs that are located inside in a woman. The female reproductive system as a whole is comprised of both exterior and internal organs, and it is this system that is accountable for sexual activity, menstruation, and fertility in the female. The following are the primary components that make up the vulva, often known as the external genitals: labia minora, labia majora, vaginal opening, clitoris, beginning of the urethra, hymen. On the other hand, the internal components consist of the following: cervix vagina, uterus, fallopian tubes, ovaries. The reproductive system of a woman is responsible for a variety of important activities. The reproductive system will assist an individual in bearing children in addition to enabling sexual activity to take place between a man and a woman. Eggs are generated by the ovaries, as you might already be aware. During the process of ovulation, the eggs are moved to the fallopian tube, which is the location where the process of fertilization may take place. After fertilization, the egg will go to the uterus to become the embryo. This is the part of the uterine lining that thickens in response to the hormones that are normally present during the menstrual cycle. When the fertilized egg reaches the uterus, there is a chance that it will grow into a baby by implanting itself into the uterine lining. During a menstrual period, the uterine lining will shed if it has not been implanted with an embryo. In addition, in order to maintain a regular and healthy menstrual cycle, a woman's reproductive system will create sexual hormones. When a woman reaches menopause, her body will gradually stop producing female hormones, which are essential for maintaining regular periods. During this stage of the life cycle, the cycles may be erratic before finally coming to an end. After menopause, a woman will no longer experience periods of menstruation. Follow these steps to ensure that your reproductive system receives the best care possible. Taking care of your reproductive system shouldn't feel like a chore or an obligation to you. By taking some of the actions listed below, or all of them, you will ensure that your health is in order and that you do not experience any issues with regard to your ability to conceive a child. Regrettably, over the past few decades, a growing number of people have adopted unhealthier lifestyles, which can wreak havoc on reproductive health. For example, participating in sexual activity without proper protection can significantly increase your risk of developing a variety of sexually transmitted diseases, also known as STDs. As a consequence of this, a person who has an STD that has not been treated may experience complications, which may ultimately result in infertility. It is in your best interest to seek the advice of a qualified medical practitioner, such as Dr. White, Vidya, in order to obtain a professional diagnosis and the most appropriate course of therapy for you. Maintaining a consistent schedule of checkups with your primary care physician is essential if you want to keep your reproductive system in good condition and functioning properly. Keeping this in mind, the following are some of the most effective techniques to improve the health and fitness of the reproductive system. Treating sexually transmitted diseases, also known as STDs, is important. In the United States, approximately 19 million people are diagnosed with a sexually transmitted illness, also known as an STD, each year. The good news is that there are some effective techniques to reduce the likelihood of becoming infected with the virus. The most important step you can take to ensure your ideal reproductive health and wellness is to educate yourself on sexually transmitted diseases, STDs. how to prevent contracting them, and how to get treated for them. Get tested as soon as you can if you suspect that you may have a sexually transmitted disease, STD, or that you may have been in contact with someone who does. You should also encourage your spouse to undergo testing and appropriate treatment in the event that the findings come back positive. There are situations in which an STD does not present any symptoms. If symptoms are present, however, they may include abnormal discharge, discharge with a foul odor, sensations of burning and itching, as well as pain in the vaginal area. Maintaining a regular testing and screening regimen is one of the best ways to guard against sexually transmitted diseases, STDs. Put an end to your use of tobacco and alcohol. Numerous problems with reproductive health are associated with both smoking and drinking alcohol. For instance, the majority of people who smoke and drink alcohol also have issues with infertility and other difficulties. Quitting harmful habits like smoking and drinking alcohol can not only boost fertility, but it will also bring about a number of other beneficial changes to one's health. When men smoke, it can reduce the amount of sperm they produce and the volume of their semen. When it comes to women, smoking up to 20 cigarettes a day has been shown to disrupt regular menstrual cycles and result in a lower egg count. Always choose for some form of birth control. Utilizing birth control methods is the most effective strategy to plan pregnancies and increase the likelihood that both the woman and the child will be born healthy. Unwanted pregnancies make up almost half of all pregnancies that occur in the United States. By carefully preparing for your pregnancy, you may improve your overall health and ensure that your unborn child has the best possible start in life. IUDs, or intrauterine devices, are highly recommended as a method of long-term birth control by medical professionals. Condoms are something we recommend because they can also help guard against infections that are transferred sexually. Take charge of your weight and get it under control. There is a correlation between being overweight or underweight and having issues with reproduction. Men should also make it a priority to maintain a healthy weight. To be more specific, the sperm count could be affected when a guy is overweight and has an elevated amount of body fat. On the other side, women who are either underweight or overweight are more likely to experience issues during ovulation as well as possible miscarriages. As a result, we advise maintaining a healthy weight and striking a balance between the two in order to avoid problems with reproductive health. Consume supplements in order to improve your health. If you are trying to have a kid and want to boost your chances of conception, experts recommend avoiding smoking and drinking and having regular pregnancy tests. This will increase your chances of becoming pregnant. Your first order of business should be to work these modifications into your routine as soon as possible. You could also think about taking a prenatal DHA and omega-3 fatty acid supplement if your physician gives you the green light to do so. Your physician may also recommend that you take 800 milligrams of folic acid on a daily basis. When it comes to men, the most effective supplements are coenzyme Q10 and multivitamins. Consume a diet that is both nourishing and balanced. It's important to watch what you eat. The consumption of a nutritious and wholesome diet that is rich in vitamins, minerals, and high-quality protein is highly recommended by specialists as the best way to improve reproductive health and boost fertility levels. Be sure to consume a lot of meals that are high in fiber as well as whole grains. Unfortunately, a large number of individuals rely on processed foods that are loaded with unhealthy fats, refined wheat, and sugar. Even though many of these foods have a tendency to have a pleasant flavor and become addictive, eating them can lead to weight gain and even infertility. Instead, focus on consuming a wide variety of fresh vegetables, fruits, foods rich in omega-3 fatty acids such as seafood, chia seeds, flax seeds, almonds, and salmon, and high-quality sources of protein such as tofu, chicken breast, fat-free yogurt, and grass-fed beef. On the other hand, consume as few processed foods as possible and stay away from coffee. So was this video helpful? Let us know in the comments and give this video a big thumbs up. Subscribe to our channel to watch more of us. Thanks for watching.